Thank you for joining us tonight for a special 40th anniversary Crystal Ball. We're excited to be gathered here tonight to honor incredible members of our community and support Hunterdon Health Foundation. As many of you know, each year we honor 3 individuals and organizations with the spirit of Hunterdon in recognition of their significant impact on Hunterdon Health's success and the improvement of health in our region. We have continued this tradition for 20 years, and in 2019, we formally agreed to recognize individuals in 3 key categories: the corporate spirit, the community spirit, and the philanthropic spirit. Tonight's honorees are a testament to this award. Each has left an indelible impression at Hunterdon Health, especially in the last 2 years. And in doing so, they have had a tremendous impact on the greater Hunterdon community. We are honored that they have accepted tonight's award, and we invite you to join us in celebrating them together. Pegasus Emergency Group is comprised of all board-certified, residency-trained emergency medicine doctors from nationally recognized top medical schools and ER-trained nurse practitioners and physician assistants. Since its formation in 1996, it has been Pegasus' philosophy to build a team of experienced leaders who are passionate about providing exemplary emergency medicine for the community at Hunterdon Medical Center. Collaborating responsively and transparently with Hunterdon Health, they have provided the best patient care while working to achieve hospital performance objectives. Today, Pegasus is comprised of physicians and physicians' assistants serving more than 35,000 annual emergency department visits. In addition, they staff Hunterdon Health's 2 urgent care facilities in Flemington and Raritan with more than 25,000 patient visits per year. Pegasus is quite literally the gateway to the only medical center in Hunterdon County. That is because more than 90% of Hunterdon Medical Center's inpatients enter the medical center through the emergency department. And when the COVID-19 pandemic locked down our entire nation, like their peers across the country and throughout Hunterdon Health, this group came to work each and every day to provide emergency and urgent care on the front lines. The group and its leaders have also been loyal supporters of the foundation. They are often seen participating in events and most recently made a generous commitment to the ongoing emergency department expansion. Hunterdon Medical Center and Pegasus are proud of the achievements in patient care and the emergency department and urgent care. Tonight, it is my great pleasure to introduce you to Pegasus, our corporate Spirit of Hunterdon recipient.
Before Pegasus, the emergency department was primarily run by family practice physicians. Literally at nighttime, the ER nurse would page the family practice house officer to come see the patient. But emergency medicine was growing, and the standard was for residents that were specifically trained in emergency medicine to start staffing emergency departments. And Pegasus was born out of that philosophy of having all board-certified residency-trained emergency physicians.
I have had the privilege over the past 34 years to work with Pegasus not only as a staff RN, an off-shift supervisor, a nursing leader, but most recently as an executive. The emergency department is the spoke in the wheel that connects and holds it all together. It really is imperative that we get it right the first time a patient comes into the emergency department, because it probably is their first experience or encounter with the organization.
We are dedicated to providing outstanding quality emergency medicine. We live in and around Hunterdon County, and we volunteer on the hospital committees. We volunteer to staff the COVID vaccination sites, and we're very involved with Hunterdon EMS. We're not a national organization. We're focused on Hunterdon County and providing great services here where we live.
What makes Pegasus unique is the relationships that their providers have with our providers and our staff. There's respect, they treat each other like family, and this rolls over to the care that they provide for the patients in the emergency department. They treat each and every patient as if they were caring for their own family, and I've personally experienced this myself. Pegasus is committed to quality and safety. They are a true partner, not only for the organization and nursing, but the community as a whole.
COVID has made the work of emergency medicine and urgent care very challenging. We have been at the front lines since the start of the pandemic. We never closed, we're always open every single day, never stopped seeing patients, both COVID patients as well as emergency and urgent care patients. We've had to isolate ourselves from family in order to protect ourselves and the staff from getting COVID. I joined Pegasus Emergency Group in 1998 and took over as president in 2004. Since taking over, we've contributed to every capital campaign for a total of over $500,000. It has been an honor to support the foundation and all its events from year to year. Pegasus Emergency Group is extremely honored to be awarded the Spirit of Hunterdon Award. We are proud to be a part of this wonderful community and look forward to continuing our synergistic relationship.
Congratulations, Pegasus and the entire team on being the recipient of this year's Spirit of Hunterdon Award. Well deserved, job well done.
Joyce Glinowitz and her husband Stan moved to White House from Mountainside, New Jersey in the early 2000s. Joyce, director of the Human Resources Technology team at Merck, and Stan, retired from Exxon, were very active, enjoying hikes, biking, and exercise, and truly appreciating the open space the Hunterdon community had to offer. Immediately after moving, they began looking for a place to exercise. It wasn't long before they fell in love with the Hunterdon Health and Wellness Center at White House Station. Over the next decade, it would become evident to them that the group exercise space in White House wasn't large enough to meet the demand. Members regularly could not attend classes because they were filled to capacity by the time they arrived. Joyce and Stan, who had been avid supporters of the foundation to this date, decided they could make a difference. They began speaking with the wellness centers and medical centers leadership to see if it was possible to enlarge the space. Before long, they committed a significant gift to build the Joyce and Stan Glinowitz atrium at the White House Wellness Center. Sadly, Stan passed away in 2015, but Joyce has continued to be an avid supporter of the foundation and the Wellness Center. This year, the Joyce Glinowitz Open Space Studio was opened, providing space for exercise to be done outdoors. As she put it herself, exercise does not need four walls. Nobody knows more than Joyce how important exercise is to our overall health. Thanks to her philanthropy, exercise is now available to more members than ever before. Tonight, it is my great pleasure to introduce you to Joyce Glinowitz, our philanthropic Spirit of Hunterdon honoree.
What makes Hunterdon Health stand out is its focus on health and wellness. Beyond that, it's the management. The management is probably the most important part of it because they have the willingness and the flexibility to make change as needed.
Joyce, what can I say about Joyce? Not only is she a valued member of our Wellness Center family, but she cares deeply to keep our community healthy and joyful. Throughout the years, Joyce and her late husband Stan have generously contributed to the wellness centers as well as to numerous initiatives within Hunterdon Health. These contributions have led to many new programs and enhancements and have helped many along the way. Her kind and generous nature has propelled the Wellness Center to a higher level.
My husband and I decided to make a contribution to Hunterdon Health back in 2013. And the reason being is that the Wellness Center was offering new classes. The room was so small it could only accommodate about 10 people. So we knew the capacity limitations were going to be increasing as time went on. So we made a donation for the expansion of the White House facility, and that led to some conversations, and over a period of 5 years, finally the implementation. My husband passed away in 2015, and one of his last wishes was to make sure the expansion got done. And I'm happy to say that yes, it did get done. It got done in September 2018, and that's when we had the ribbon cutting for the atrium. To me, philanthropy means recognizing where there's a need that can benefit a lot of people and then coming up with solutions to address it. Giving has a lot of benefits to the giver as well as to the receiver. I pulled into the parking lot one day and I saw someone using the new outdoor studio. And it was a beautiful day, and it was just a great feeling. That was one of the benefits of what we did. I'd like to thank the foundation, Phil Beekman, the staff at the Wellness Center, including Mary, Shelby, Rory, and others before them who were involved with the expansion, including Bob Weiss and Tammy, along with Neil from engineering, were all instrumental in getting this done. And so to them, I thank them very much for making this project a success.
On behalf of our Wellness Center family, I would like to thank Joyce and celebrate her for all the good she does within our community.
Peter and Candace Teuber know medicine well. Peter has more than 3 decades of experience in the pharmaceutical industry and a proven track record of developing successful specialty pharmaceuticals. Candace has over 25 years of experience in the pharmaceutical industry and has been providing regulatory strategic leadership and implementation as a senior consultant to pharmaceutical companies of all sizes and stages of development. Together, they founded Orphan Therapeutics with the purpose to develop and seek regulatory approval in the U.S. and Canada for a drug to treat hepatorenal syndrome, a form of impaired kidney function that occurs in individuals with advanced liver disease. Candace also suffered with debilitating pain before she learned it was a result of late-stage Lyme disease. Because of the severe impact on her health and on their lives, she and Peter have come to learn a lot about tick-borne diseases such as Lyme that are so prevalent in our community. So when fellow Stanton Reformed Church parishioners and Hunterdon Health Foundation trustees introduced them to the medical center and its leadership, they immediately felt compelled to volunteer. Ultimately, both were asked to join the health systems board. Peter joined in 2011 and served on the Quality, Compensation, Strategic Planning, and Operations committees, while Candace joined in 2018 and served on the Executive Committee as chair of the Foundation Board. Their guidance helped build the Hunterdon we know today. The Foundation raised more than $20 million during Candace's tenure, and the board recruited new members. The Toibers have been avid supporters of Hunterdon Health Foundation. In 2017, they sponsored a Lyme disease forum led by Hunterdon Health that was overwhelmingly supported by residents. Through the foundation, they sponsored research conducted by Dana Price, Associate Research Professor at the Rutgers School of Environmental and Biological Sciences, to study tick populations and the diseases they carry in the county. The study, similar to another one conducted in 1996, would help answer the questions as to why there were so many more cases per capita of Lyme disease in Hunterdon County than other locations with denser populations and higher field infection rates. We're proud to call Peter and Candace great friends of Hunterdon Health and Hunterdon Health Foundation. Although they have moved to Florida, they continue to call Hunterdon their second home. It is my great pleasure to introduce you to Peter and Candace Toiber, our Community Spirit of Hunterdon Honorees.
My husband Peter and I, and our 3 sons, Henry, Sven, and Lucas, all lived in Hunterdon County for over 20 years. While the kids were growing up, we had many experiences with Hunterdon Health, starting with the birth of our last son, and then managing acute and chronic illnesses. The list goes on. And at each of those occasions, we had compassionate and excellent care. My motivation to become involved with Hunterdon Health stems from both a personal and professional perspective. Personally, I've experienced the challenge of chronic illness and also have lost close friends and family to devastating diseases like cancer. So I strongly believe that your health is really your most valuable asset. And also when you're ill, you're at your most vulnerable. So it's a real gift to be able to be treated with care and compassion and dignity. And I've experienced all those with my Hunterdon Health providers. Professionally, as a pharmacist and a pharmaceutical researcher, it's my passion in life to heal people and to help and to promote overall wellness.
Candace and I have worked all our career in the pharmaceutical industry. Like so many other families in Hunterdon County, our family was also affected by Lyme disease. And so Candace and I were eager to do something about it, and we were very grateful to be offered an opportunity to work with the administration and internal as well as external experts on Lyme disease to develop a public lecture as well as grand rounds for physicians and healthcare workers on how to prevent, diagnose, and treat Lyme disease.
Peter and I are so grateful for this gift to be honored by the Hunterdon Health Foundation. It's also been a great privilege to work with my fellow board members and the foundation staff. It's such a pleasure to work with a talented group of individuals whose collective passion for helping others inspires their work every day.
I just love to work with so many passionate people to offer high-quality health care right here in Hunterdon.
We both feel that volunteering at Hunterdon has been an extremely enriching and gratifying life experience for us both. And we'd also like to say thank you to the Hunterdon Health providers, staff, and volunteers, especially during the last 2 challenging years. And from the bottom of our hearts, we'd like to say thank you You make this a very healthy and special place to live.
Peter and Candace have been an integral part of the Hunterdon Health community. They've taken their talent in the public sector and the pharmaceutical industry and their commitment and passion for this community and brought it here where they've been part of our leadership. In many ways, they've helped shape the Hunterdon Health system we have today. On behalf of the Health System's Board of Trustees, our employees, the patients we serve, and the greater Hunterdon community, congratulations to you, Peter and Candace, on this incredible honor. There is nobody more deserving.